Hi, everyone. This is Beth Rogan. I'm the Associate Director of Marketing and Outreach, and I'd like to welcome you today to our William James College What is Neuropsychology online presentation. Thank you so much for joining us during your lunch hour today, and I'm really happy that we are able to provide this program. It's quite unique to be able to talk just specifically about neuropsychology in the clinical PsyD program here at William James College, and we have our expert, Dr. Osher, who's going to be talking about the program today and about neuropsychology. So thank you for joining us. I think you'll really find this very helpful as you are researching kind of your interests and pathways in psychology and behavioral health. I will be acting as your host and just want to take a couple minutes to provide a little bit of an overview about William James College and then to kind of manage any questions that come in. So I hope that you'll be asking questions which we'll be addressing towards the end of the presentation today. So I'm quickly going to just introduce our speakers, and they will be talking a little bit about themselves as well. So Dr. Jason Osher is the Director of the Neuropsychology concentration here at William James College. He's also, as you can see, the Director of the Center for Faculty Development, and he's an Associate Professor in our Clinical Psychology department. And I arranged to introduce myself, Beth Rogan, and Elizabeth Beaton is the admissions counselor who is with us today, and she'll be answering some questions that you may have and providing a little bit of information later on in the program, as well as she is handling the tech end for us today. So thank you, Elizabeth. And we'll move on, please, Elizabeth, to the next slide. So this is just a little bit of a housekeeping slide. As you can see, you have an opportunity, because this is a live webinar, to ask questions. So please do that, and we'll be addressing them later. There also is a handout in the near control panel in the handout section of the PowerPoint. So what is neuropsychology? You're allowed to or able to download that so that you can take that with you if you'd like. So the next slide is a little facade, a picture of William James College. And if you are local, you may know that we reside in Newton, Mass, which is right outside of Boston. And I always like to say it's about a 15-minute ride into non-rush hour into Boston. So we're in a great location. There's a lot happening, of course, here in this area, this wonderful area of the country. It certainly is a medical and psychological mecca, so it's a great place to learn and grow. And speaking with that, I'd like to talk a little bit about what's happening inside this building, the wonderful culture, our fabulous practitioner faculty, and the students that we have that are so engaging with all of the departments and programs that we do have. One of the things I'd like to talk about is what makes William James College quite unique, and those are really our core values. And they happen to be, and we're very proud of them, experiential education, social responsibility, and personal growth. And in terms of experiential education, as I mentioned, we have practitioner faculty who are experienced, they're practicing, they're doing the work, and they are wonderful mentors for our students. We have an experiential education model, and in general, our programs are one where our students are able to apply what they're learning in the classroom right into the field. And most programs, you start right away, and that is true with the clinical psychology program. In the first week, you're in your practicum as well as your coursework with a seminar to bridge the two. And so that is a model where our students are able to really take what they're learning in the classroom and apply it right away. And it's a very powerful way to learn and experience what you're learning. So with that, we also have, as I mentioned, the practitioner faculty in the clinical psychology department. We have over 50 faculty who are clinicians as well, or practicing. And also wanted to mention that with that, we have about a 1 to 12 ratio for faculty to students in advising. So you're certainly not a number here. You're very well known to the faculty, to your advisors, and it's a good thing. It's a good thing. So you have many opportunities to be mentored and for personal growth here in the program. And as far as social responsibility, it's key to our mission at William James College. It's something that we are proud of. We look to see how we can make a difference. So we're making a difference by looking at how to serve underserved populations and breaking down barriers that exist around behavioral health and mental health and psychology to equip our students to become multicultural clinicians and agents. So with that, I think we'll move on to our next slide. So this is an overview of the programs and departments and offerings at William James College, and the neuropsychology concentration is in the clinical PsyD program. And we also have a counseling department that has Masters in Clinical Mental Health Counseling online and on campus. With that, we have various concentrations. So in the counseling program, we have couples and family therapy, forensic and correctional counseling, health and behavior medicine, and substance use and addictions. And just to move back to the clinical department, in addition to the neuropsychology concentration, we have geropsychology, CFAR, which stands for Children and Families of Adversity and Resilience, health psychology, and forensic psychology. Organizational leadership psychology, we also have that, those offerings, and within that department, our staff and students are working, our faculty and students are working within departments and organizations to see how they may create positive change and unique and efficient environments. They apply the theory of psychology to do so, to make those assessments and to work with organizations. We have an undergraduate program, a bachelor's in psychology and human services, and that program is a completion program where students have the equivalent of an associate's degree and are looking to get their bachelor's. So they're generally working and going to school, and we support that with them. And in school psychology, we offer MA CAGS in school psychology and an ABA program as well. So that will be kind of a quick overview of the offerings here at William James College. And now we can move on to our next slide, where I'd like to introduce Dr. Osher.
Thank you, Beth, and welcome everybody to this webinar. I'm really happy to be here and share some information about neuropsychology. But first, I'd like to start with just how I got into the field, a little bit about myself. So I actually started in undergrad with an interest in psychology, but I thought at the time that I was going to go into doing couples therapy or family therapy, and actually had stayed away from all science classes as much as I could. But as part, I was a psychology major, and as part of my major, I needed to take a physiological psychology class, and did so in my junior year, and realized how much I really enjoyed it, how much I really liked it, and had a passion for it. And quickly, in the last year and a half that I had, I scrounged up a biology minor and took as many of the bio classes as I could to beef up my knowledge, and realized that this career choice really led in two different directions, or one of two possible directions. One was to either go to medical school and become a neurologist or something like that, or to go into the field of psychology and possibly pursue neuropsychology. And at the time, I was still unsure about which way I wanted to go. So I decided to take some time off before going to graduate school. And I worked in as a cognitive rehab specialist, so I was working with individuals who had suffered some sort of brain injury and who were trying to return to work, helping them reintegrate into the community or into their jobs. And so I really got to learn a lot about what it's like, how the brain works and what happens when the brain gets injured. I also worked with a lot of different colleagues at the time. Some were neuropsychologists and in other professions as well. And it really solidified my desire that neuropsychology was the right way for me to go. And so I ended up first, I got a master's degree and then went and did my doctoral work at Northwestern in Chicago, where we had a focus on working with older adults, in particular with individuals who have dementia. And so I did a lot of work in that area. Ended up coming to Boston for internship and postdoc. As you will hear a little bit later on in my presentation, neuropsychology is one of the longer specialty areas in the field. So there's a lot of steps, and I'll go over those a little bit later. But ended up coming to Boston to do internship and postdoc, and developed an increased interest in training and supervision and mentoring as I was doing those. And was trying, as I was finishing on my postdoc and trying to figure out where to go next, I realized that I really wanted to find a job that would allow me to work with students, to help train students, whether it be in a clinical setting or in an academic setting. And as luck would have it, at the time, William James College was looking for, they were looking to develop a neuropsychology concentration. So it was fortuitous that we were both at the same time looking to do something very similar. So I came here, that was almost 9 years ago now, and developed the neuropsychology concentration. And so I've been here since then. And as I've been here, I have expanded in my interest into many other areas and really understand the role that neuropsychologists might be able to play in the broader field and the broader kind of workplace that's outside of just providing neuropsychological assessments. So I'll talk a little bit about that as well. So that's a little bit about me. So let's go to the next slide, please. So before we start, I like to do a little kind of interactive component here. So for those of you who are on, in a minute, I'm going to share some words on the screen. And I want you to take a minute. You don't have to write anything down, but I just want you to look at the words that are going to appear on the screen and try to remember as many of them as you can. Again, I'm going to give you about a minute to do so. And then I will take them off. And I want you on whether it's be on your computer, on a piece of paper that you have, if you can write down as many of the words that you can remember after they're leaving, after I take them off the screen. So first, you're just going to try to study them and try to remember as many as you can. Okay, if you go to the next, please. Remember, don't write any down now. Just try to remember as many as you can. All right, about half a minute left. Okay, if you go to the next slide, please. Okay, now I want you to try to just take a second and jot down as many of those words that you can remember. I'll give you a minute to do so. And as you're putting this together, what I'm going to ask you to do, if you feel so inclined, is after you've kind of exhausted your ability to bring up any of those words, I'd like you just in the chat, if you feel comfortable doing so, sharing how many of those words you were able to bring back up. So I'll give you another second to do it, and then feel free to type that into the chat at any point. Okay, go to the next slide, please. One more. Good. Okay, so you might still be trying to get some of those words, but I figure I'll start. And as you come up with your final number, again, if you want to share that in the chat, if you feel comfortable doing so, please do so. And we will discuss that as we move along. So here, really, the question that many of you are here is, what is neuropsychology? What is the field of neuropsychology? So next. Right, so initially at its core, it's really the study of brain and behavior. I always feel a little funny talking about this because technically all of psychology deals with the brain and behavior, but it's really just the field of neuropsychology that focuses on understanding kind of brain behavior relationships, understanding how the brain works and how we apply that clinically. Okay, next. Right, so understanding how this relationship between kind of the structure and function relate to behavior. So if you go to the next slide, and one more. Right, so here's a picture of a brain right here. This brain we're looking at on the left side, so it's as if it's looking to the left side of the screen here. And one of the things that we know, and this is over an obvious oversimplification, but we know that there are many different areas in the brain, and the brain controls many different functions. And so what neuropsychology as a field is doing is understanding how these two relate to each other, how different areas of the brain, how they end up controlling the various things that we do, how they help us interact with the world, and also kind of understand information that we're getting. Okay, next slide. Again. Right, so first, neuropsychology is a science, right? And so the way that neuropsychology is applied as a science is in a variety of ways. So next, please. Right, so just understanding brain behavior relationships can be played out in a number of different ways, right? So some neuropsychologists really just study human cognition, or they do animal studies, or they get down to kind of the molecular and cellular components. This is applicable in industry or clinical trials, or even academics, you know, who have very robust kind of research that they're doing on how the brain works. And this is really just to understand a little bit more about what it does. So we have some understanding right now of what the brain is doing, but there's a lot we still need to know. So this work is really important. Next, please. But really, I think most of you are here because you're interested in the clinical practice side of it. So how does neuropsychology play out in the clinical realm? So next, please. Next. Right, so really the question is, what is clinical neuropsychology? So neuropsychology falls at the junction of a couple of different other fields, right? So it kind of is somewhere in the middle between psychology, neurology, and psychiatry. It has elements and overlap with many of those fields. Really what we're doing here is understanding how the brain works, how that impacts our daily functioning, and how in various conditions things go wrong in the brain and what that looks like. So really that's where neuropsychology falls. So with neurology, neurologists really deal also with the brain in the medical field, focus a lot on problems that can happen in the brain, but a lot of it has to do with either treatment or diagnosis. Psychiatry is similar, right? So there's overlap in the kind of conditions that we see. Psychiatry and psychology tend to manage very similar conditions, but psychiatry tends to take a little bit more of a medical approach and maybe deal with treatment medications, where psychology might look at more interventions. So neuropsychology functions at the center of all these. Next, please. And so what do we do? Next. So the main thing that you might have heard of is that we do clinical evaluations, right? This is different. You might have just heard of testing. It's more than testing. Testing is one component of what a neuropsychologist will do, but neuropsychologist's skill is in the ability to take a lot of information about a person and synthesize it towards understanding what is going on and what would be the most helpful. So that includes many different components, including testing. Most of the time, it's for the purpose of either diagnosis or aiding with diagnosis. It could be for patient care and planning or assessment of treatment. And we'll go into some of these in a little bit. Next, please. There's also an intervention side, which is not often mentioned, but is definitely becoming more popular in the field, which I will talk about in a second. Next. And so the last thing, I think I mentioned this earlier about the understanding of neuropsychologists, the clinical evaluation and intervention are very oftentimes what is mentioned when it comes to the work that neuropsychologists will do. But I believe that there's also other possibilities because the knowledge that we have in terms of how the brain works is applicable in many other areas, whether that be in industry and education, in law, in forensics, and so I think that our skill base lends itself to careers in many different fields. And so my hope is that, and what we work on here at William James College is preparing students to be able to work in a variety of settings, whether it be in the clinical setting or in these other settings that I mentioned. Next, please. Okay, so first starting with the diagnosis side. So next. Right, so here are some of the ways in which we aid in diagnosis. Oftentimes there's a question of, is a condition more fall into the psychiatric realm or the neurological realm? A very common distinction is something like a patient comes in and they are having some trouble with their memory. Is it because this person is developing a dementia syndrome, or is it because this person is severely depressed, which can also impact memory? And so helping do an evaluation to help piece that apart is one of the things that we can do. Also, between kind of the different neurologic syndromes have very distinct presentations and might appear differently when we do our evaluations, and so helping distinguish between those two. Localizing lesions is really kind of the history of the field. So before we ever had any kind of imaging technology, this was the neuropsych evaluations were the only way that a clinician would be able to know where in the brain something was damaged. Now we can turn to images for that. And so there's a little bit more of understanding how what we see on the images might play out functionally. So that's a little bit more of what we do. And then aid in prediction, so helping families and patients kind of understand what's coming, right? So if we carry a certain diagnosis, to help them to understand, well, this is how it typically progresses in the brain, and this is what you should expect to see. Next, please. So care and planning, oh, there you go, right here. One of the areas in terms of care and planning is really understanding the significance of what we're finding on our evaluations toward real life. That's, I think, one of the main areas where neuropsychologists shine, is understanding. So if someone comes in and complains of memory problems, as we said before, what is the extent of those problems and where might that have the most impact in that person's life? You know, if they are in a job that relies heavily on that skill, then it might have more of an impact, or it might not have an impact at all if what they are involved in their everyday life is not impacted by that area. So really helping families to understand the kind of the situation and then plan for what is the best route to take, both in terms of treatment and maybe in terms of kind of making changes to their life to make to improve their quality of life. So here are some other areas within the care and planning realm that neuropsychology can help with. Legal issues is a big one also. There is a whole separate subfield of neuropsychology and forensic neuropsychology that really helps manage situations related to forensic issues. So that could be whether or not people are competent to stand trial, or really better understanding the nature of someone's disorder and how that might have impacted either what they did or their situation. Okay, next, please. So assessment of treatment is another big area for the field. So next. Right, so many different types of conditions that require treatment. It's sometimes hard for other clinicians, neurologists, to understand, what is the impact of the treatment. Sometimes we can directly know, if you take a medication because you're sick and you get better, then that's one way to know that the medication is working. But with thinking and cognition, it sometimes can be harder to really understand if there's improvement. So many neuropsychologists might do an evaluation before a treatment is started, and then subsequently after a treatment has been going on, to see, are there differences? Is there improvement in certain areas? What is the treatment being most effective for treating? And so this is in regards to injury recovery or drug studies. It could be a surgery. It could be some kind of training program. If someone is enrolled in a memory training program to help boost their memory, they can do an evaluation before and after to see, was there an actual impact of that program. Next, please. All right, so let's get into a little bit of the details about the components of a neuropsychological evaluation. So next. First is the interview. That's really one of the key parts of it. When I talked about the evaluation is more than testing, the interview is where we start, and actually might even be more helpful towards really understanding a person's situation than any of the tests that we give. We have the luxury in our field of being able to spend a lot of time talking with someone, understanding their situation, getting a sense of what's been hard and what hasn't been hard, what problems they're having, really diving into their history. And so many times the interview, I would say, is the key component of an evaluation, and might lend itself to really many of the formulations and the conclusions that we draw, even more so than the testing at sometimes. Next, please. Right, then there's the actual assessment components that we are also able to do. And this includes many different types of assessments. It could be paper and pencil, some on the computer, some that are self-report by the individual coming in to be evaluated. And also we try to gather information from informants. That could be family members, spouses, whoever, who might be able to also shed some light on what's going on. And sometimes individuals may not have as good an understanding, or may not notice certain things that their family members might notice. And so it's helpful to gather information from other informants as well. Next. Oftentimes, after we've gone through a whole evaluation, we provide feedback to the clients, to their families, about what we have found, what our recommendations are, where they should turn to next. This can be formal. We sometimes schedule feedback sessions with them, or it can be informal, just through reading the report. So there's a variety of ways that neuropsychologists might handle this depending on the setting that they're in. Next, please. So here's just a picture of what a testing situation might look like. Here's someone evaluating a neuropsychologist evaluating a client on a particular test. It's usually we spend a lot of time in this kind of environment. Actually, these days now, with everything that's going on, we've been doing a lot of virtual testing, and so that was always something that was out there, but now has increased in usage given the pandemic. And so we are now also able to do a lot of this through the computer by either presenting materials over the screen or just asking the questions in that way. Next, please. So the actual assessment components, what the paper and pencil or the computer tests are doing, evaluate a number of different areas. So can you go to the next? Right, so normally the two main things that we evaluate using those tests are cognitive abilities and also psychological functioning. So when I say cognitive abilities, I'm really referring to these areas that are listed here: someone's attentional capacity, their memory, language. Premorbid functioning refers to tests that have been developed to kind of estimate what this person's kind of level of functioning was prior to something that may have happened. Because that's one of the key components, is understanding what this person's baseline is at and how they're functioning now compared to their baseline. And so we have different tests that evaluate each of these components, and also many questionnaires where we start to get into how are they feeling, is there any kind of depression, anxiety, or other factors that may also be impacting their ability to think, to function normally. Next, please. So one of the things I want to go back to here is that I didn't see anybody, when no one wanted to volunteer their numbers in the chat, which is fine. Everybody can hold on to it. But normally about, people recall of that list, probably about 10 to 15 is probably an average number on that list. Next, please. One of the things that you might have noticed as you were going through that was that there were different categories of words, that if you organized the words based on categories, then you might be able to remember more. So in actuality, that test, some people may think that that was a memory test, but understanding how that test works and how the brain works, you would actually understand that's more of a test of your ability to organize information. Had I asked you to try to recall now how many words you remember, that would be more of an assessment of your memory. But just your ability to look at a list and organize it and then bring it back up right away, that's not actually testing your memory, that's testing your ability to pay attention and your ability to organize, what we call attention and executive functioning. And so it's really that those are the kind of distinctions that neuropsychologists are able to make in really understanding where someone's difficulty might lie, even though they might be reporting it as a memory problem. This is in actuality maybe related to some other function here. For those of you who may have recognized that there were categories, the likelihood is that you would have been able to remember more of the words, because what ends up happening if you can organize it well, then you actually are remembering just the 6 categories, and more of the words you'd be able to recall. And so the people who recall more are usually able to do that, and so they might show strengths in something like executive functioning. Next, please. And one more. So just to some of the common conditions that we see as neuropsychologists. So next. These are just an example. The field has certainly expanded. These are, I think, the more typical ones, but these days, many people are being referred for a variety of reasons that include these, but also people who are just concerned about their thinking and their cognitive abilities. So it might be that it's a 65-year-old who is otherwise healthy, but is just worried that their memory is not what it used to be and just wants to get some clarification as to, is there actually a memory problem or is there something else that's going on? Because sometimes, our ability to think does change as we age. And so it might just be normal, but it might be indicative of something else. So people kind of worried well, we usually call them, might come in for a neuropsych evaluation that don't necessarily have any of these conditions. Many of these conditions are listed because they end up impacting someone's ability to think, whether it be attention, memory, and so on. And so they come, and clinicians are typically looking for clarification onto the extent to which someone's cognition is impacted by their condition. Next, please. I talked a little bit that there were interventions. That is also, certainly the history of the field was more focused on the evaluation side. It was more of a consult service. But now there's many more neuropsychologists who are involved in various types of interventions. These might include something like cognitive rehab, which oftentimes for individuals who suffered some sort of injury, very often this is some sort of TBI or traumatic brain injury, who are trying to rejoin the community. This is a little bit of the work that I did before grad school. It's really understanding how can people learn how to do things differently? How can they use the parts of the brain that were not damaged to help compensate for the parts of the brain that were damaged? And so they'll go to rehab settings to do that. And so that's a very common intervention that neuropsychologists are well prepared to give. But also even just doing therapy, all neuropsychologists are clinical psychologists first. We'll talk about how all neuropsychology programs are housed in clinical psychology programs. And so you have the general skills to be able to provide interventions, therapies, and so on. And so, but you might be able to use your specialized knowledge of various conditions and how the brain works to help a certain target population. So it might be individuals who suffered a brain injury and had to change their life around and are really having a hard time adjusting to this new way of living. That's a really great type of patient where you really have an understanding of the brain injury side of it, but also might be able to provide some sort of therapeutic intervention as well. Next, please. And so where do neuropsychologists work? And pretty much anywhere. There's a number of different settings that neuropsychologists are housed in. Academic medical centers are a big one. Here in Boston, we have a number, pretty much all the major academic medical centers, Massachusetts General Hospital, Beth Israel, Deaconess Medical Center, Tufts University Hospital, all have specialized, and some even have more than one specialized neuropsychology clinics that the hospital can refer to. At Beth Israel, there's actually one housed in neurology and one housed in psychiatry, so there are two separate ones. But all the major medical centers, even around the country, usually have some sort of neuropsychology service built in. But also at smaller hospitals or veteran administrations, those are big also in terms of neuropsychology, neuropsychological services. The VA, most VAs also have a specialized neuropsych clinic since they're dealing with many individuals who had TBI or other issues that impact cognition. And so many VA hospitals, you'll be able to find neuropsychologists. But then also in private practice or a primary care clinic, you might see them in group practices. We talked about forensic settings, and also in schools. There's a lot of overlap between understanding how cognition impacts kids' ability to do the work that they need to in schools. And so you'll find neuropsychologists working there. Next, please. Okay, so getting into how do you become a clinical neuropsychologist? So next. So firstly, this field is relatively young in the general field of psychology. Even it started kind of gathering itself together back in the 60s, but then in the 90s, there was a conference in Houston that set out the guidelines for training. And so now you might hear the term Houston Conference Guidelines if you are looking into neuropsychology programs. These are the general guidelines that outline what are the training requirements for all neuropsychologists to get. And so that's where the guidelines started, and now programs will adapt those into their programs. Next. So the first is a doctoral level study. Neuropsychology is a doctoral level concentration or specialty. And so it needs to be, you need to have a doctoral degree of some kind. Next. This could be either a PhD or at a PsyD program. Next, please. Right, so we have a PsyD, Doctor of Psychology program. There are neuropsychology concentrations in PhD programs. And actually, you could also become a neuropsychologist in an EDD program, in an education doctorate, but probably the majority are in PhD and PsyD. 1 year predoctoral internship is required, as is a requirement for all clinical psychologists, and so that's no different. There isn't a specific requirement that you do neuropsychology, have a neuropsychology focus at your predoctoral internship, since that's supposed to kind of round out your training. Though many trainees will do specialized training in neuropsychology on their internship. Okay, next. So the 50% is recommended, but not required if you're going to go on in the field, and that's really to stay competitive. Next. The 2-year postdoctoral fellowship is a requirement for the field. This is something that was laid out in the Houston Conference Guidelines, and so the idea is that you will be doing a 2-year postdoc after you finish your doctoral degree that is focused in neuropsychology. This is where at least 50% of your time is spent doing neuropsychology focused activities. And it's 2 years. So that in total this is what makes training to become a clinical neuropsychologist one of the longer specialty fields, right? So if you factor in doctoral level study plus an extra 2 years, you're looking at probably somewhere in the 7-year range to your finish. The nice part about doctoral internship and fellowship is that you're out there, you're working, you're getting paid. So it feels a little bit more like you're not a grad student for those years, but it is still a training program. Next. This is all leading up to board certification through ABAP, which is one of the boards in the general field of psychology. ABAP has a number of different specialty areas, and neuropsychology is one of them. And so all the different experiences lead you to be eligible to sit for the board certification exam. And that's really considered to be the gold standard in the field of neuropsychology. There's a number of steps you have to do to become board certified, but also there's kind of a records review, or kind of your training review, to make sure that you've gotten everything you need to that point to call yourself a neuropsychologist. And the field is moving in a direction so that at some point you will require to be board certified to either bill for services or to get certain jobs. Even now, most jobs will advertise for a board certified or board eligible clinician to join them. So it's something that if you're thinking about the field, you should definitely make sure that you are setting yourself up to be eligible to take the board certification exam when you're finished. And this is different from licensure. Licensure is a general psychology thing. Board certification is specific to neuropsychology. Next, please. So doctoral training in clinical psychology. I want to talk a little bit about the components of doctoral training. So firstly, even though you kind of primarily do a lot of the emphasis at the postdoctoral level, there's a lot that you do beforehand, right? So it's laying the foundation. So a lot of what we do at the doctoral level is laying the foundation so that when you go to the postdoc, you're able to kind of hit the ground running. Next, please. As I mentioned, all neuropsychology training programs are housed in clinical psychology. So you need to be able to get a clinical psychology degree, and then you find a program that has a specialty area, either concentration or track in neuropsychology. There are some programs out there that will call themselves neuropsychology doctorates, and those are not recognized by APA as specialty training. You have to get a clinical psychology degree with a specialty in neuropsychology. Next, please. So a neuropsychology concentration is generally, our track is designed to follow the Houston Conference guidelines. Not all programs will have a concentration. A concentration is not a requirement to go on in the field. It really just allows, next please, it really just allows for an easy way to make sure that you're kind of getting everything you need to within the field. So whether it be access to neuropsych faculty, research labs, clinics, practicum sites, coursework, curriculum. For the board certification process, there are certain content areas that they want you to have, and if you can get that in a class, that's really the best way to do it. Next. But it's okay if there's no track, because as I said, there's not a requirement. So next. It's important if you are looking at programs that don't have a track in neuropsychology, then it's really important to be proactive to make sure that it has the elements you need, whether it be the coursework, the availability of field placement sites, or faculty who are focused in neuropsychology, just so that you can kind of set up your own track within your program. Again, it's not a requirement. Many students will go to programs that don't have neuropsychology tracks and go on in the field, but it certainly makes it easier when all of that is organized for you within a concentration. Next. And we just talked about that, so next, please. And one more. Right, so first, the coursework, right? So in addition to the basic clinical coursework that you would do in a program, really good competitive programs or students will have coursework in some of the following areas. So next, please. So neuroanatomy and neuropathology are kind of key. Those are lay the foundation. Understanding how the brain works, well, then everything will build on that. Psychopharmacology, neuroimaging, neuropsych assessment, case conceptualization. You may have specific classes in these areas, or they may be built into some of the other classes. The idea is that you are gaining content knowledge, and that's really when it comes to board certification, they're looking for you to show that you have content knowledge in these areas. It doesn't have to be in the coursework, but it's easy to show if you've taken a class in a particular area that you've attained certain content areas. So it's important to look for coursework that covers some of those areas. Next, please. On the field placement side, next. Right, so really the goal for field placements is exposure to a wide range of different diagnoses, tests, clinical settings, age ranges, conceptualization styles. A lot of people approach it differently. So you want to get exposed to as much as you can to lay the foundation and kind of give you an idea of how different neuropsychologists approach the work. Next. So you want to find experience with doing interviews, administering the tests, scoring, writing reports, working on a team, Those are all the things that students will typically get at a standard neuropsych field placement. Next, please. And next, yeah, so the typical settings I think we mentioned before, hospitals, mental health clinics, or private practices, that's the majority of the field placement sites that our students at William James go to is in those areas. And we have it built so that in the first, that students in the concentration will do 2 placements and to kind of build on the foundation and then some of the advanced skills. I'll talk about our placement in a little bit. Next, please. Finally, research is going to be a component of any doctoral program. It's part of the APA accreditation requirements. And so, but the field of neuropsychology definitely places a strong emphasis on research and scholarly interest in product, even if you're going to be a clinician. Just the ability to understand, to synthesize, to take in, and to kind of do research is an important piece. And so many students will take on, certainly in our program in the concentration, will take on maybe a little bit more, a little bit of a heavier role in research than some other students will do. Next, please. And there's many ways to show your participation in research, whether it be participating in journal clubs, presenting posters, helping faculty write book chapters, even getting publications or grants if you're able to do that. So depending on the program you go to, these might be options for you. And it's important to just look at some way to be involved in research to show that you are being productive in the field. It'll really help make you more competitive as you move through training in this field. Next, please. And obviously, if you're going to do that, making sure that your dissertation or doc project is germane to the field, is relevant to the field of neuropsychology. So next. So I want to quickly just lay out our neuropsychology concentration, just as an example. I think we've worked hard to make sure that it covers the areas needed. So in terms of coursework, we have courses in neuroanatomy, neuropsych assessment, neuropathology, case conceptualization, and a number of elective courses that students get to pick from to kind of help hone their interests. This provides, and this is all in sequence, and so it kind of builds on itself. For our placement sites I mentioned earlier, students are doing in the second and third year out of the 4 years that you're in placements, you spend 2 years in neuropsychology focused sites. The first placement in your second year, really focusing on the foundational skills, kind of test administration and scoring. And then after that, really going into a placement where you get to hone some of the more advanced skills, report writing, case formulation, and so on. And then obviously, a 5th year APA internship at a site, most students will go into one that has a neuropsychology component. And then research for the concentration, similar to what I mentioned earlier, the doctoral project has to be germane to the field of neuropsychology. I take a pretty liberal stance on that because I think there's a lot of application there, but that's what it has to, that's what the requirement is for the concentration. Next, and I just wanted to bring up some good organizations if you're looking for more information about neuropsychology. Here's a list of various organizations in the field, all of which have a lot of good information for students looking to get into the field or just to get more information about what the field is like or jobs available. So please check out any of these different organizations, and the websites are listed here for any of that information. Next, and I think now I will hand it off to Beth to answer any questions.
Great, thank you. Thanks, Dr. Osher. Okay, so just a quick one, is neuropsychology an on-campus or online program?
So typically it's a question of whether or not you're asking now during the pandemic or generally. Generally, it's an in-person, it has to be in person only because APA, as part of their clinical psychology accreditation, is an in-person program. So normally they don't allow for online programs to be accredited through APA. Obviously right now, most of us are functioning online, and so they are allowing for that. We'll see what happens as things, smooth out, whether or not there's some change in that requirement. But historically, it had to be an in-person program.
Okay, and then Julia wants to know do you have a pediatric neuropsychology specifically under the clinical psychology concentration?
So it's a good question. We have a number of students who are interested in pediatric neuropsychology, and what a lot of students will do in our program, because we have a variety of concentrations, and we do have one CFAR, the Children and Families of Adversity and Resilience concentration, which is our pediatric concentration in the clinical program. Students will kind of dual concentrate in some cases, or will do one of them as a lighter concentration and the other one. And so students might, I have a number of students now who are doing a combined CFAR neuropsych, and so they're getting the pediatric experience, and their neuropsychology experiences are focused in the pediatric realm. We have a number of field placements that are focused in pediatric neuropsychology, both at the Academic Medical Center at Tufts and their children's department, and also at a number of the private practices. And then as part of we built the coursework to be very general, that covers both the pediatric and adult realms, and then through the electives that are left, students might select to either go to a particular population. So if you have an interest in peds, there are classes that you can take that'll help solidify that.
Okay. Caroline wants to know, as she's an undergrad college student, what type of internships should I look into that would help me decide whether or not neuropsychology is something I want to specialize in?
It's a great question, and I think this was certainly my question first when I was trying to decide which way to go. So it's a little difficult at times to think about what are the jobs that you can do, but there are a number of different types of jobs you can look for that will help make this decision for you. In terms of internships, really, if you could find an internship that is housed in a medical center that allows you to be exposed to individuals working closely in this realm, whether it be in a neurology clinic, a psychiatry clinic, where you're going to interact with people in the field. Certainly, ideally, if you can go and work with neuropsychologists, that's going to be the best. Many neuropsychologists, and I would recommend reaching out to them if you are local or in your local area, are happy to have students come in and kind of shadow an evaluation just to see what it's like. I certainly did this when I was doing more clinical work, and I did this as a grad, before when I was deciding. But you can go in and they might be open to coming in and just seeing what it's like, or having a discussion with them. Some other opportunities, so for jobs or other types of things that you can do if you're looking to get into the field. So many students might work as research assistants with neuropsychologists on the research side. And so we'll just be able to understand a little bit about the field that way. The cognitive rehab, there's a lot of opportunity for individuals without a doctoral degree to get some work in cognitive rehab. As I said, I did this with a bachelor's degree, and I did that work initially working with individuals, and that really helped me figure out what it might be like to work with these populations. And also I interacted with a ton of neuropsychologists in doing that work. So really, whatever kind of position is going to expose you to the field, whether it be expose you to the type of population of patients or clients that you're going to work with, or to the clinicians themselves, I think is the best way to go.
Okay, so we have quite a few questions, but I want to just shift a little bit over to the admission process. So both, maybe you and Elizabeth can help with this. We can start. There's two questions. One is, will you also explain about the admission process and what is the general admission requirement for this program? And just in addition, someone is asking if they have a master's in let's say they have a master's in clinical psychology, so can they apply for admissions in that program? So Elizabeth, do you want to start?
Sure, I will address that. Hi, everyone. My name is Elizabeth, and I work in the Office of Admissions here at William James College. So to apply to become a neuropsychologist through William James College, you would apply to the Clinical Psychology PsyD program, and you can open an application online through our website. Right now we are accepting applications for fall 2021, and there are deadlines coming up in December and in January, December 9th for early consideration and January 6th for general consideration. So now is the time to be thinking about applying. To apply, you would fill out the online application, and then you would provide us with different materials that include your CV or resume, a 4 to 6 page application essay, 3 letters of recommendation, your GRE score, and transcripts from all colleges or universities that you've attended. And when we're reading your application, we're trying to assess if you are academically ready for a doctoral program. And so that's why we're looking at your GRE score, letters of recommendation from academic references, your transcripts, and then we're also assessing if you have the interpersonal skills necessary to succeed in the program. Can you build trust and rapport and build relationships with other people? Clinical experience is fantastic to see on a resume and to bring up in conversation with you. And so after you submit your materials and we have a complete file by the deadline, then we pass it to be reviewed by our faculty members, and then they would determine if they want to invite you to interview for the program. Your interview would take place January, February, or in March, and then after an interview is when you would hear from us with our final admissions decision. In terms of the person who has already completed a master's degree, with a master's degree in clinical psychology, you may be eligible for an application status known as advanced standing. Advanced standing students enter the program as second-year students. So the clinical psychology PsyD program normally takes 5 years to complete, and advanced standing students complete it in 4 years. So essentially 1 year from your master's program would transfer in. And information about that is posted on the website. You can read about advanced standing under transfer of credit. And in a little bit, you will see the contact information for admissions, for Dr. Osher, and for so if you want to get in touch and have a longer conversation, I would be happy to have a consultation with you. You can send your questions by email, and then we can go from there.
Okay, great. I think, Dr. Osher, can you say something about applying for the concentration, and also what do you look for as an ideal candidate for the program?
Sure, yeah. So for all concentrations, I think this is important to know, for all concentrations within the clinical psychology department, students apply to those, well, except for one, which I'll mention in a second. Students apply to those after they get here. So they go through the admissions process that Elizabeth just outlined for general admission to the program. You are able to indicate, I think, for CFAR, potentially coming in and starting that program initially, but for most of the other concentrations, and this is true of neuropsychology, you come here, you kind of get settled in the program, and then it's a process while you're here to declare for the concentration. And within neuropsychology, I'm looking for you to take certain classes. So students usually take the functional anatomy class first, and then get some an endorsement from their advisor that the concentration is a good fit for them. So I want students to take a little bit of time to make sure that it's the right area to go into before they do that. In terms of the types of students I look for, I think many students come to me initially with an interest in the brain, and they say, oh, I really love the brain, and this is the area that I want to go into, and then realize that they might not like assessment so much or other areas. So I think it's good for you to do some of the research beforehand and really understand a little bit of what the role of a neuropsychologist might be. There are ways to apply knowledge of the brain in your work in therapy, and you could be a CBT therapist that applies understanding of the brain to that work. So just knowledge of the brain, to me, is not going to be enough to sustain you in the field. So I really am looking, I think the students that are most successful are the students who have done some research into the field, understand a little bit about what the work entails, have had some experience or will get some experience when they get here with assessment, because that's really some of the main things that neuropsychologists will do. And so take that time to kind of look into it and are okay with the length of time it might take to get trained in it. I think that that's something else to know, just because it's a long process.
Okay, so there's a couple questions about the work. Dr. Osher, there's one about how often are people referred to neuropsychologists?
People are referred a lot. I mean, most clinics, certainly in this area, have wait lists. Some of the hospitals, I think, have wait lists, up to 6 months to a year before you can even get in for a neuropsych evaluation. So people are being referred all the time for neuropsychology. I think it really depends on the specific setting. Within very specialized clinics. So for example, like an epilepsy clinic, neuropsychologists are part of the team and see every patient that comes in for an evaluation of their epilepsy. And so that is just ongoing. As patients come in, they're getting seen. In maybe a private practice or a group practice, they rely on other clinicians out in the area to refer to them. But there certainly is work to go around for neuropsychologists. Pretty much in any particular area, business is pretty good.
So one quick question, and maybe our last question because we're heading up to 1 o'clock. In the past, I've heard a lot about neuropsychologist roles in areas like brain injury, learning, and neurodegenerative disorders, etc., but not in psychiatric disorders. Can you talk a bit more about their involvement with issues like anxiety, mood disorders, and schizophrenia, etc.?
Yeah, briefly, because I know we're almost out of time, but
Yeah.
essentially the idea is that all those disorders, oftentimes people still present with problems with paying attention, maybe problems with their memory. So if you are, an example, if you are severely anxious, you are going to have a really difficult time focusing and paying attention. But sometimes people don't realize that they're anxious and just realize that they're having trouble focusing and paying attention. So they might come to a neuropsychologist to better understand, why is it that I'm having trouble focusing and paying attention? And through our evaluation, we're able to say, you know, it's really because you are very anxious. And if you go and treat your anxiety, your attention span will likely improve. And so many clinicians who are working with individuals with anxiety and depression might refer to a neuropsychologist to really understand, is there problems or cognitive problems related to the disorder that they're being treated for, or is there something else going on? And so that's very often why neuropsychologists might be bringing to the picture in those cases.
Great, thank you so much. So we're past 1 o'clock, so we're gonna stop for now, and just want to make sure that you see the contact information and emails there for the Office of Admissions, info@williamjames.edu. Dr. Osher's Jason_Osher at williamjames.edu, and Hillary Baxter is the Director of Financial Aid. So her email is there as well. You can contact us and connect with us, please, through social media. I think you have a great sense of our community. And also, Julia says, thank you very much. It was very informative. Thank you, Julia. And please check out our website. There's lots of information on that, as well as other webinars coming up. And we stay tuned. We have an open house coming up in November. Elizabeth, we have a date for that, right? Is that have we solidified a date yet, or was that a stay tuned kind of thing?
Off the top of my head, I think it's Saturday, November 14th.
14th. That's what I have down to. Yeah.
But we'll be emailing people, and it will be posted on our website, so you can check there for the open house and upcoming webinars. If you want to sit in on one specifically to the clinical PsyD program, then you are more than welcome to do so. And I look forward to staying in touch with you. And thank you for joining us today.
Yep. Thanks, everyone. Thanks so much.
Bye-bye.